In November, I went to India with my daughter and her kids. And I started having, I can't see properly, I thought, on my left eye. And as the days went, it kept on increasing and increasing. Then I came back from holidays. I came to London and I went to Radhika and asked, can you just examine? I didn't say my reasons. I said, can you please see my eyes? And she looked at it and she said, Mom, you've got cataract. You need surgery. That is how it started.
When she started describing her symptoms to me, I was like, wait, these are coming on really fast. So when I examined her in my own clinic, I could clearly see that she had this big cataract that was almost like a sheet of cataract at the back of her lens, and that's why her vision deteriorated very quickly. I knew that we wanted to give her full range of vision, essentially. So I came with an open mind to Shiraz to see what the options were after her full examination. And it was very strange being the kind of daughter of the patient, and listening and things. But it was great to be able to go and, look at all the scans together with Shiraz and pick the lenses together. And yeah, so we gave her the two options of the full range of vision or the offset with the increased range of vision. And in the end, actually, her examination dictated what she could have.
It's extremely flattering to look after a colleague's mother or father, or even a colleague, and I've done many. But it's also, at the same time, a bit daunting. They can't help but influence you in your decision-making process. So it's a real discipline of detaching and doing things and looking at everything objectively and then making a decision accordingly. So in Radhika's case, she wanted her mother to have fine vision lenses because that's a platform that she's used to. And obviously she wanted her mother to have a full range of focus, to get everything in both eyes equivalently. Well, why wouldn't anyone want that? But when I examined her for ocular reasons, we've had experience with ISOPURE and Serenity more recently. That was a much better option. I showed her data, our preliminary data on Serenity, which is completely outstanding, and showed us as well, this is a full increased range of focus lens. It's not a full range of focus lens, but with a bit of micromonovision, we could give her the independence she's looking for. And I felt there was a much better option, a safer option for her mom. And that's what we did. The lens is an interesting lens. The ISOPURE, which I had a lot of experience with before, was very, very good. But it wasn't as reliable as Serenity. And I think that the difference between the two lenses is the platform. Serenity has the 4 C loops. And that is fantastic in terms of centration. So you've got 4 points of contact that are centered. It's also superb for patients who require toric lenses. That lens does not move. It can be rotated by tilting and rotating or nudging and putting into position, but it doesn't move afterwards. And we've checked that with our patients. I know that lens performs well, but every patient is an individual, and how they heal and how they behave, and they're medically related. And you know what it's like when you operate on medical people, they wind up having all the problems. So yes, a bit worrying, but it was very reassuring seeing her the next day and finding that she had this phenomenal vision, and she had incredible freedom from glasses and felt quite liberated. I'm pleased to say that her vision is 6/6 in a dominant eye, 6/7.5 in a non-dominant eye, and she has equivalent of 6/9.5 in a dominant eye near at 40 centimeters and 6/6 in a non-dominant eye. So she's got pretty good near vision in spite of being almost planar. And her refraction is -0.25 in the right eye and -0.75 in the left eye. And with both eyes open, she doesn't need glasses at all. So it worked. I planned it, and it worked completely to plan, which is great. But I have to say, I did a lot more head scratching, and I had to think about this.
When I watched Shiraz doing the procedure, I was in there. The lens implantation itself was so straightforward, and at the end of it, when she kind of got up from the bed, I actually had tears in my eyes because it was a really why am I getting... It was a really special moment.
Everything was so clear and so bold. I can read book, I can do the text.
The result was like way more than I was expecting, actually. So we're really impressed. And now I'm excited to use the lens myself.